I am talking to you right now as a frustrated healthcare provider. COVID-19 is no joke. I cannot understand how I still see people walking around without a face mask or people gathering in large numbers. Do you want to come to the respiratory hospital? Do you think it is fun if you have COVID-19? Can you imagine being unable to speak, having chest pains, coughing so much that you actually pee on you? Can you imagine being so weak, having difficulty breathing that you think you will die? Having so much mucus that you have to be spitting all the time? People, take care of yourselves, follow the protocol, and stop blaming the government. Okay? The government is not responsible for you not wearing your face mask, not sanitizing your hands, not maintaining social distance, still gathering in large numbers, and doing all kinds of things you're not supposed to be doing. Blame yourself. If you don't want to follow the protocols for yourself, follow them for me. Follow them for the healthcare providers. Imagine being in personal protective equipment for an extended period of time. You have two face masks on. You have a simple face mask, then you have the N95. Plus, you have a face shield. Then you have your gown, you have a cap, plus you have shoe covers on you. When you're doing a procedure, you can hardly see because of all of the sweat. You have difficulty breathing. Don't ask for when you want to pee, poop, spit. Imagine me and I have my period for a whole 5 hours and I'm in PPE. I know, right? Ew. Take care of yourselves. The hospital is so crowded right now. We do not have space for people. People, take care of yourselves. Stay at your homes. Do what you're supposed to do. When you're at your home, isolate. Stop making people come at your home to visit you. This is very serious, and it is just so surprising that a lot of persons are not taking it as serious as it is. People, we are frustrated, we are tired. Every day I have to leave work how late? I have so many things to do, and I am just one person and I have so many persons to take care of. Obviously, care will be compromised, and it is no joke. We have limited staff, we have limited resources, we have limited PPEs. I don't know what to tell you again, but take care of yourself. It is really frustrating, and it is really frustrating to see that we are trying our best at the hospitals and persons are still going on social media and talking about the nurses this, the nurses that. We are trying our best. So do your part so you'll not have to come to the hospital. And some persons are saying we are causing patients to die. That is not true. Do you know the psychological effect it has on you to constantly see persons taking their last breath? I can tell you, most days when I'm at work, I want to cry. Because I am seeing we are trying our best, we are doing so much, yet still persons are just dying. It is not our fault that the patients are dying. We are trying our best. So stop saying that we are killing people, because we are not killing people. Lucians, take care of yourselves. Okay? I don't want to see you come into the hospital and you're so sick that we cannot do anything for you. I am not going to force persons to take the vaccine. I am pro-choice, but the most we can do is just educate persons. So if you think taking the vaccine is the best thing for you, then do that. If you don't want to take the vaccine, that's you. But take care of yourself. Drink plenty of water, try to exercise, eat a nutritious and a balanced meal, get plenty of rest, keep to yourself, stay away from others. Just follow the protocols and stay indoors. That's one of the most important things. You will have enough time for you to go and fet later on in life, because if you die now, what's the point, right? What is the point? Do what you have to do. If you do not care about your family members, you do not care about your friends, you do not care about yourself, care about us, because really and truly we are frustrated. We do not even get paid any risk allowance, and we work with COVID-19 patients all the time. Okay? Imagine I was working with a patient today and the patient insisted on removing the face mask. Every time I went to the room, the face mask was always on the floor. So I was honest with him. I told him, sir, if you do not keep the face mask on, you will die. You know what the patient told me? One way or the other. What does that mean? Either he dies from COVID-19 now or he dies from something else later. It's like, No pa mele. Person pa mele. That's your health. Don't you want to stay an extra year on earth, or an extra 20 years, 40 years, have your family, see your family, have their family, and just continue the legacy that you're doing right now? You mean to tell me you're so concerned about you meeting your selfish needs right now that you will not even consider the needs of others? And most times the persons who actually get the virus, sometimes they do not even die from the virus. They transmit the virus to somebody else, and the poor soul has to suffer the consequences from that person's irresponsibility. So take responsibility for your actions, be accountable for what you do, and stop blaming us. Stop blaming the government, but blame yourself.